Dr. Meriden Glasgow, an OBGYN at the OBGYN Center, and I've been practicing obstetrics and gynecology for 17 years. I've had the pleasure of serving the Batesville area for the last 13 of those.
Caroline Carlton. I am one of the OBGYNs here in Batesville, Arkansas. I have been out of medical school about 20 years, and so although 4 years of that was in residency, all those 20 years have been focused on obstetrics and gynecology. Currently, there is a large debate, obviously, over COVID vaccines, and we are trying to encourage people to get good information to make their decisions. One of the things that we have seen is people are afraid, and that is a normal response to something that is new and unknown. We don't want people just to be afraid without us helping them get over that fear by giving them good scientific information that's unbiased and can help them make a better decision to protect themselves and their family.
The risk of the COVID-19 disease are much greater and potentially more devastating than the risk associated with vaccination. We know that pregnancy and the postpartum period are high risk times in terms of severe disease and risk of death from COVID-19, and that vaccination can significantly reduce these risks. We're seeing much sicker pregnant and postpartum women with this particular peak of COVID-19 than we have in the past. Vaccination rates in this particularly high-risk population are unfortunately lower than what we would like to see.
Just want to encourage everyone to, if you have not been vaccinated, to look at that, to look at the reasons why you're choosing not to. We don't want people to make those decisions based on fear. For our group of pregnant ladies and postpartum ladies here in our office, not only are we encouraging them to get the vaccine, but we're encouraging those who are with them and their baby to get the vaccine. So significant others, other family members, people who are going to be supporting them during this process, anybody who's going to come into contact with them, if they're vaccinated, will help protect them as well. As we know, vaccines are not available for small children or infants at this time. Having a vaccine actually can help protect your baby.
COVID vaccination does not negatively impact fertility, and it does not hurt the unborn child. There is evidence that antibodies are passed along to the baby in pregnancy and with breastfeeding, and this can be particularly helpful if the baby is exposed to COVID-19. The national professional organizations regarding pregnancy and fertility do recommend vaccination of all pregnant and postpartum women, as well as women who are trying to conceive or may become pregnant in the future. And recently, the FDA has given full approval for the Pfizer vaccine. It is no longer being used under emergency use authorization. There's a lot of confusing information out there, but I want to ask you to consider reputable sources when making your decision about whether to vaccinate. Talk to a healthcare provider that you trust, particularly those who are taking care of the sickest of our COVID patients right now.
We would encourage anybody who is on the fence or unsure or just has more questions to try to get what I would call good information, scientific information, unbiased, not just opinions that you see posted on Facebook or from your friend of a friend. There's a lot of evidence out there that is being posted, but it's not factual. And so I think it's really important that when we're making these decisions that we do not just research, because research doesn't necessarily always give you the right answer. Let's do good research, find good information to make those decisions.